Welcome back. As we enter a new school year, there appear to be some signs that mental health among teens is improving. The CDC reports a slight drop in the percentage of students who have an overall persistent feeling of sadness, of female students who are feeling sadness or hopelessness, and the percentage of black students who have attempted suicide or who were injured in a suicide attempt. But we still have a long way to go when it comes to teens and their mental health. Joining us to talk about what's going well and where there is room for improvement and what parents can do to support their children, we welcome back to the show Tom Duff. Tom is the Executive Director of the CHADS Coalition for Mental Health. Thanks for being here.
Thanks for bringing the topic forward.
Of course. The CDC does this survey every couple of years, and it's called the Youth Risk Behavior Survey. Tom, this latest survey, I think just based on the years, it was looking at 2021 to 2023. That gives us some insight into how teens were affected by the pandemic. So the good news is that between those years, it looks like things improved slightly. And we mentioned a couple of those things, persistent sadness, suicide attempts in certain groups. So everything's gone down a little bit. And that is, you could say, good news. So what do you think is the reason for that?
Yeah, it's great news. Anytime we can have a decrease and kids saying they're not as lonely, they're not feeling as hopeless, it's amazing. So I think with the pandemic, we saw a huge influx of funding for mental health. There was a huge awareness factor that we all have mental health. I kind of call that the Ted Lasso effect, that everybody has mental health. And so everybody was able to kind of come together. So when I look at that and the focus, we were all focused on the same thing. And when we have more funding, that means more services and more accessibility. So I'm not surprised to see that there was a decrease, but that number is still pretty significant.
I was going to say it was about 2%. And like you said, any number in a decrease in a problem is good. Would you consider that like statistically significant, as they say?
You know, 2%, when you're looking at from 42% to 40% is basically where the research was at and what the data showed us. So that 40% is still a lot of kids that are needing help, that are still high schoolers, right, that are saying, like, I have significant amount of loneliness, I have a significant amount of sadness, and those aspects are really associated with depression and everything that comes with that. So
the good thing about the pandemic is it really did shine a light on mental health and programs in schools and outside of schools. And there are some red flags about raised from that survey about violence and safety concerns, either at school or on the way to school. Let's take a look. An increase in the percentage of students who are reporting that they've been threatened or injured with a weapon at school, that they've been bullied at school, and they've missed school because of safety concerns at school or on the way to school. And that is concerning because we think about schools as being a safe place for students, but that's not always the case. I mean, we hear cases locally about kids being bullied on the bus to or from school. Yeah.
And I think that's this overarching theme that is of concern, because those are factors that all kids are experiencing because of social media, because of the ability to see live action, right? And we know just here in St. Louis, we've had some significant issues from a social media perspective on recording different violent acts. And so that creates this level of anxiety that's anticipatory anxiety. So when you're going to school, you're just afraid it's going to happen because it happened to your friend.
Yeah, and we also saw significant health disparities with female and LGBTQ plus students, higher rates of violence, poor mental health, and suicidal thoughts than their peers. I would like to say at least there's some good news because we are seeing many schools putting attention to that. Are you seeing that in the St. Louis area?
Yeah, definitely. You know, we see that there's a lot more support groups formed inside of schools for looking at youth that may be of a different minority or a different group that is at more risk for mental health issues. And so when we look at that and the school's emphasis on emotional health, they realize that kids are coming to school for more than just academic performance and testing and those aspects.
Let's get into what CHADS Coalition does.
Yeah.
You are St. Louis-based. Tell us where your efforts get into this whole question of mental health.
Yeah, so our major focus is to save young lives. We want to advance the prevention and awareness of depression and suicide. So we know that suicide is a factor that, you know, one suicide is too many. And right now, that's the second leading cause of death for youth. And so That's our focus, and we are in over this past school year and for this next school year over 280 different schools that we're doing prevention strategies to educate not only the students but the faculty as well too, mentoring people who are at risk, and then providing therapy to kids as well. And so we know that those are all aspects that create a different atmosphere for a kid inside of a school.
Is there a trend or something you're noticing?
You know, unfortunately, there's major themes going on, right? So you have the bullying that we kind of talked about, social media, the influence that is there, and the pressure. You know, so what we see that kids are exposed to a lot more of just real life issues, worldly issues. Schools as well as youth are very well that it's an election year, that it is a divisive culture we live in. So we're hearing that a lot from our kids as well, which is concerning.
So what types of guidance do you provide them when it comes to, when you think about those real world issues? I think about the end of last year, we talk about the election and what's going on in the Middle East. A lot of things were creating stress at school and, you know, at home and in the community.
So open dialogue with people you care about, right? So as kids, a lot of times they're going to keep things bottled in, right? They may not think they should go to their parent and say, I'm struggling with these thoughts, or to an adult. So we focus a lot on who in your life do you have a relationship with, and it's okay to talk about. And that also equals into the world of working with parents as well too, is how do we open up dialogue and relationships, because that is key, and to get the facts around the situation. So just because you hear it one way from your friends doesn't mean that's everything that you need to know. So search and Google the facts.
It's kind of like news consumption. We know you saw the headline, but you got to go beyond, think with a critical eye.
Yes, exactly.
And what are some of the signs that you are seeing of anxiety with especially with the beginning of the school year?
Yeah. So right off the bat, you know, kids might be coming home with physical ailments. I feel sick. I have a headache. I feel nauseous, right? So that's not a flu, right? That's not the fever that goes with it. These are things that kids may be dealing with, where the emotional side is coming through. We're watching kids have a little bit more irritability. So you as a parent, when you see that, you need to kind of check in. You're seeing kids that may be dealing with this avoidance or disorganized thinking. And those are all signs that they're dealing with something emotionally instead of just kind of the behavior that you're seeing. And
also really being in touch with your kids. And it looks like this one's on a tablet. I mean, seriously, the phone, the tablet, and really be in touch with what they're doing.
Yeah, so you have to, as a parent, you got to set boundaries. Kids need structure. We all need structure, but kids need structure even more. You have to be attentive, and you need to open up those conversations in a non-judgmental way. Because we want to do that, the non-judgmental way opens the door for future conversations.
One thing I want to bring up are the schools. The CDC has recently come up with recommendations in the last, must be the last couple of months, about schools providing an environment that is supportive and nurturing, and I love seeing that they are encouraging yoga and meditation. They didn't have that when I was growing up.
Yeah, well, yoga is the world of mindfulness, right? And so when you talk about kids that are feeling dysregulated, emotionally dysregulated, yoga has an ability to bring them kind of into themselves, to experience what they're feeling, and to be able to, and that's one of the biggest things, is knowing ourselves and what we're feeling on the inside and what behavior we might be displaying. Do they connect? You know, so if I'm irritable and I'm worried about something, am I lashing out because I'm worried, or am I really angry? It's
really identifying those feelings and the connection between the physical and the mental and the emotional, everything interrelated.
Exactly.
Well, that is promising to see that in schools. Well, great conversation as always. I'm glad we could talk about that CDC study. Some interesting findings there.
Amazing.
Thank you to Tom Duff with Chad's Coalition for